Hello everyone, my name is Ashish Sai, Assistant Professor in RPIIT Pharmacy, and today is my topic about Alzheimer disease. What is the Alzheimer disease? A neurodegenerative disorder characterized by cognitive and behavior impairment that significantly interfere with the social and occupational function. It is also known as senile dementia of Alzheimer type, or it results from an increase in the production or accumulation of specific protein, beta amyloid protein in the brain that leads to nerve cell death. These are more likely common in African Americans than in whites. According to WHO review, the global burden of dementia, approximate rate of dementia under 1% in person age 69 to 69 years and 39% in person age 90 to 95 years. Etiologies factors include advancing age, family history, trauma, education, muscular disease like stroke, and risk factors are the common risk factor for increased age, hypertension, cholesterol, coronary artery disease, diabetes, genetics, smoking and alcohol use, plasma homocysteine, Down syndrome, mild cognitive impairment. Pathophysiology, there are two signature lesions in Alzheimer's disease. They are neuroleptic plaques, that is beta amyloid plaques, which are dense deposition of protein, and neurofibrillary tangles, which are twisted fiber and build up inside the nerve cells. The neuroleptic plaque is the deposition of protein fragments called beta amyloid directly in the space between the nerve cells. Amyloid precursor protein is the precursor of amyloid plaque. It sticks through the neuron membrane, and then like beta secretase and alpha secretase cut the APP into the fragments of proteins. And this is the pathophysiology of Alzheimer disease. Amyloid protein cleaved by beta secretase and alpha secretase, mutation of amyloid protein in chromosomes, and increased production of amyloid precursor, produce of amyloid protein, and accumulation of beta amyloid protein and reactive neurotoxin and Alzheimer disease. And other is neurofibrillary tangles. It is an internal sports structure partly made up of microtubules. The protein called tau helps the stabilize microtubules in AD. Tau changes causing microtubule collapse, and tau proteins clump together to form neurofibrillary tangles. And this is the pathophysiology of Alzheimer's disease due to neurofibrillary tangles. Symptoms are cognitive symptoms, non-cognitive symptoms, functional symptoms. Cognitive symptoms: memory loss, aphasia, apraxia, disorientation, impaired executive function, depression, psychotic symptoms, behavioral disturbance, and functional symptoms are inability to care for self. So these are the Alzheimer's disease and etiology and symptoms. Thank you.